Welcome students for today's lecture in psychiatric nursing. We are going to see psychotherapy. Previous weeks we have covered psychopharmacological methods of treating mental illness. Now we are shifting our view towards the psychological treatment of mental illness, which is known as psychotherapy. The psychotherapy is a Greek origin English word where psych means breathe and spirit and soul. The therapia means healing medical treatment. So the meaning of psychotherapy is treatment of a disease by psychic way, that is by using some hypnotic methods. The first psychotherapy was used in treatment of mental illness during 1953, and later it has been developed in various forms. Now we move on to the definition of psychotherapy. Psychotherapy is the treatment of disorders of the mind or personality by psychological or psychophysiological methods. So we treat mental illnesses by various methods. One method is physical method by using electroconvulsive therapy, by means of pharmacological method by using psychotropic drugs, and the method which involves psychological means and psychophysiological means is called psychotherapy. The another definition of psychotherapy is psychotherapy is the relief of distress or disability in one person by another. The therapist helps the patient to relax and relieves the stress that is called distress or disability. The patient which cannot be done, incapable of doing some normal activities, that disability is relieved by psychotherapy. The approach used is based on some particular theories. For example, we have interpersonal theory, we have psychosocial theory, we have psychoanalytic theory. So based on some theory, some therapy is structured and recommend that the agent performing the therapy, for example, that you are going to do the therapy, you must have undergone that training in that area. Then only that therapy will be effective and you can be a good psychotherapist. Okay, so this is all about definition. Now come to the types of psychotherapy. There are certain criteria which we are using to classify psychotherapies. The first criteria is based on the depth of inquiring the unconscious mind. So basically the mind has having three levels based on the consciousness. We say the we have pre-conscious level, subconscious level, and unconscious level. In the unconscious level, all the bad memories, the repressed emotional feelings are hidden that we are trying to inquire, matlab investigate and try to find out what causing the conflict, and we try to find solution for the patient problem. So that is the first type, depth of inquiring the unconsciousness mind. So in this we have three subtypes. One is superficial psychotherapy, also called as short-term psychotherapy. The best example is supportive psychotherapy or supportive therapy. The next one is deep or long-term psychotherapy. This is somewhat in-depth analysis of the patient problem, that is also known as analytical therapy. And third one is very common, educative psychotherapy. We teach the patient about good things, about good behavior. That type of therapy comes under counseling. The another common name which we know is counseling. We guide the patient to choose the best solution for solving his emotional and behavioral problems. Okay, so this is the first type. The second type is based on number of patients treated per session. Sometimes we use individual psychotherapy. In this, we are focusing the treatment with only one patient at that time. And another type is group psychotherapy. We have similar problem patient together and we organize a group meeting and we discuss about each people's problem and try to find out solution for all the patients' problem. That is group psychotherapy. Commonly, 10 to 12 patients are involved per session, not more than that. That can go for ineffective if you have very large number of patients in a group. The next one is family psychotherapy. So here, the family members of the patients participate in the therapy. For example, we have a child with mentally retardation. The parents of that child will have stress regarding the psychological development of the children. So we involve the child with mental retardation and the family members to participate in the therapy, and we try to find out solution for both the children as well as the parents problem. Also couple therapy, marital therapy also used in this category, family psychotherapy. The third type of psychotherapy is based on theoretical formulation. So based on theoretical formulation, we have three types. One is supportive psychotherapy, which we have seen already. Another one is re-educative psychotherapy. Patient at the time of illness might forgotten or sometimes lost her abilities. So we try to re-educate, like for example, occupational therapy. So we try to develop them all the skills which they have lost during the time of illness. And last one is reconstructive therapy. So developing the personality which is damaged, that we try to mold, we try to develop for the patient comes under reconstructive therapy. So hope you understood about the types of psychotherapy. Now we move on to the next thing in today's class. The focus is on psychoanalytic therapy. Psychoanalytic therapy is very, very important psychotherapy, and this is you must know. When you know psychoanalytic therapy, other therapies will be very simple and easy for you. So you know the person here in the picture is Sigmund Freud, and what he told about the mind having three parts: ego, superego, id. So ego works on the pleasure principle, id works on the reality principle, superego works on the moral principle. And three levels of the mind is conscious, preconscious, unconscious. Okay, then you must know about the brain, the consciousness having the 10 parts, whatever things in our mind, information which we can remember easily is the conscious, that is only 10 percentage. And subconscious, some of the memories which we forget, but when we put effort, that can bring outside, that is subconscious, that is effort for 50 percentage. And 40 percentage of the memories, 40 percentage of the things are in our unconscious level, that can be brought outside when we have some therapeutic efforts. Now let's go to psychoanalytic therapy in detail. So this therapy was developed by Sigmund Freud at the end of 19th century. Most common indication for psychoanalytic therapy is the presence of long-term mental conflicts, which may be unconscious but producing symptoms in our day-to-day life. For many years, some problems might be disturbing us emotionally, so such problems need to be identified and given appropriate treatment. So for that type of problems, we need to go for psychoanalytic therapy. And this therapy focuses on the cause of the problem. This therapy does not give only symptomatic treatment. It identifies the cause of the problem which is in our unconscious mind, and it is trying to eliminate those problems, those conflicts, emotional conflicts. Hope you understood about the introduction of psychoanalytic therapy. Now come to this therapy makes the patient to collect all the repressed memories in the past and try to identify where the problem exactly begin. For For example, some of the worries which you are having in today's life may be originated in your childhood days. For example, a boy does not like a girl for without any reason he is having anger towards all the girls. If you go and do psychoanalytic therapy, you can able to identify that during childhood days there may be some insults happen to that boy because of some girls, because of women in the family or women in the society. So that bad memory might making the boy at present to show hatredness towards every girls without any reason. So such things, identifying where the problem exactly begin for a person, can be done through psychoanalytic therapy. So the main aim of this therapy is to bring the repressed material. Repressed material is nothing but the that is unconsciously we put some of the things in the unconscious level. So we, for example, purposefully we want to forget something which are the insults which we had in the life. Such things are called as repressed materials. So repressed material which is in the unconscious level has to be brought in the conscious awareness so that the person can work towards the health resolution of his problems. That is identifying solution for the exact cause of the problem. Okay. So this is the main aim of the psychoanalytic therapy. Now we go to the various indications of psychoanalytic therapy. The indications commonly includes phobia, so irrational fear about any things, place, situation, and you have conversion disorder. So commonly we have a type of disorder, dissociative and conversion disorder, where the emotional problems are converted into some neurological complications. Okay. And another thing is OCD, obsessive compulsive disorder, where the anxiety in a patient makes the patient to do some rituals, that is compulsion. For example, repeated hand washing and patient counting the money again and again, such problems. And next one is depression. That may be acute depression, or that may be some other moderate types of depression, can also be even severe depression also. When you do the technique properly, we can identify the source of the problem and you can resolve this symptoms. Okay. And sexual dysfunction disorders like paraphilia, you have zoophilia, okay, transvestism, gender identity disorder. So all these things can be treated with the psychoanalytic therapy. Okay, now we move on to the first type, the process of psychoanalytic therapy. So the environment where the psychoanalytic therapy will be done in the clinic, a private room will be there for the therapist. In that room, the therapist is position himself. So just you see the next slide, you can able to understand how the patient is sitting. You see that the patient is comfortably lying in a bed, or you can say that it is a like a couch. Behind that, the patient, the therapist is sitting. Why it is looking like this means, when the therapist is going in front of the patient, sometimes the patient may not respond properly. So the therapist allows the patient to freely talk about all the things. Okay. So this is how the in a couch the patient is positioned and therapist is not seeing the patient, and the therapist acts as a shadow lie behind the patient. Okay. So the main purpose is to decrease any kind of non-verbal communication between two people. Non-verbal communication plays a significant role in changing the communication pattern of two people. Okay. So patient is lying in a couch in a relaxed manner and ready to focus on the therapist instruction. The therapist who is standing behind the patient or sitting behind the patient will give instructions, and that will facilitate free association. Free association is nothing but whatever the patient tells, the therapist can able to associate the concept with a theme to identify a theme about the problem. Okay, free association. Now let's see the what are the ways, what are the roles of therapist and what are the role of the patient in the psychoanalytic therapy. First role is for the patient. Patient is very active in this therapy. So the patient is a active participant, and the role of psychoanalyst is a shadow person. He is very passive. He gives only instruction whenever needed, does not speak very fluently, very frequently with the patient. So in this therapy, patient is allowed to talk freely without any hindrances. Therapist is giving the directions in a very brief manner. Okay. So right, what is the role of patient and what is the role of therapist? Okay. Next, come to the techniques used in psychoanalytic therapy. So basically, we have five techniques commonly involved in psychoanalytic therapy. All these techniques need practice to implement in the patient setting, when you do, when you give care for the patient. First one is free association. Second one is dream analysis. Third one, hypnosis. Fourth, catharsis. And fifth one is abreaction therapy. So let's see one by one in detail. First is about free association. So here the patient is allowed to say whatever comes in his mind in response to the word given by the therapist. For example, when I am a therapist, when you are a patient, I give a word mother, I am giving a word blue. For this, I am asking you to say something related to this word. For example, you are saying evil, and also you are saying the dead. So I associate the word evil with the mother, and I associate the word death with the blue. Or sometimes you can also say mother, kind and true. So I can understand that you love your mother very much when you say the kind. When you say the evil, you I can able to associate that you hate the mother figure. So like this, the therapist gives many words. The patient has to tell the equal word to that particular word which is given by the therapist, and the therapist try to associate such words. Okay, I'm finding the theme. So by doing this, the therapist will identify which pattern of thoughts is behind that word, and the theme might give the therapist an idea to identify the cause of the emotional disturbances. I already told you, when you say for mother, when you say evil, then the therapist identify that the patient does not have any good love and emotional relationship bonding with the mother. So like this, the free association is done. Okay. Next, we want to see dream analysis. So everybody have dream in our life. That dream gives some meaning to our life situation. So Sigmund Freud believed that dreams are manifestation of the troubles of people repress memories. Okay. For example, today when we sleep, we get some kind of dream. That dream may be associated with some of the events in our day-to-day life. So that is what the dream analysis comes to tell. Better way to get an idea of the problem is to monitor and interpret the patient's dream. For example, you have worries that you cannot go outside for playing, you cannot go outside for any shopping during this lockdown period. That may be come in your mind as that you are locked inside your room. There is no TV and a lot of rules and restrictions put by your parents. So that says that what you think about the present situation, the lockdown period. Okay, so like this is one small example. So every day we get some dream. For example, you another example what we can say, you like your school very much. So when you are a college student, the school life which you spent very happily with your friends comes again and again in your mind. That shows that you enjoy the school life better than a college life. Such things are analyzed with the help of dream analysis. Patient is asked to keep a dream lag analysis of the patient. So, what as a therapist you are telling the patient to note down all the dreams as per he is getting, like date wise. So the therapist will go on, analyze the dream report which the patient is having to get additional insight into the problem. Okay, so this is about dream analysis. So the therapist will assist the patient by recognizing the intrapsychic conflicts through the use of interpretation. For example, you are running, the dream is coming. In the dream, you are running for some reason. So that shows that you have some fear for some situation or some person. Okay, so these things is coming under dream analysis. The next one, what is this therapy? What this lady is doing with this patient? So you all know. So this is one kind of psychotherapy called hypnotic therapy or hypnosis. Okay, in this therapy, we are artificially inducing a state in which the person is relaxed and usually suggestible. So we are taking the patient to a state of trance. So in a state of what we can say tranquilizing, in a state of tranquilization or sedation. Okay, so relaxation is guided by the therapist by doing some movements or by telling some instruction. That time you need to focus on the therapist eye. So when you do like that, you go for a state of complete relaxation. And hypnosis is a mean of entering an altered state of consciousness. That is, you are going from the conscious level to the subconscious level. And in this state, using visualization and suggestion. Visualization, I told you, the therapist is asking the patient to see the eyes of the therapist. Okay. Or sometimes any object is shown in front of the therapist and in front of the patient, and the patient is asked to focus on the objects. Okay, and suggestion is given to the patient every time, and by doing that, the desired changes in the behavior and thinking of the patient we can able to get back. Okay, so this is about hypnosis, and hypnosis can be induced in many ways, such as by using some fixed point. You are asking to focus on a point, a dot, or you are asking the patient to focus on a candle light. Okay, or sometimes you are using the rhythmic monotonous instructions, rhythmic movements. You are asking the patient to focus on the chain, the movement. So by doing that, you are giving instruction, and patient will get the hypnotic stage, and we can able to get the information from the patient about the emotional disturbing events. So in hypnotherapy, the relaxation is guided by the therapist who has been trained in the techniques of transformation. Now, what will happen when the patient is when the patient is getting instruction from the therapist, and the patient will try to respond for that questions unconsciously. And also guided imagery technique is used in the hypnosis, making the patient to visualize the situation. The instruction which is given by the patient can be able to visualize by the patient, and through this, in the post hypnotic session, what we are doing, we are trying to get the suggestion for that, and that when you analyze, you can able to interpret what problem the patient exactly having. Okay, sometimes we are teaching the patient to do self hypnosis, and by that we are trying to identify the problems which is causing emotional disturbances to the patient. The next method is catharsis. Catharsis is an act of purging or purification or elimination of a complex by bringing it to bringing it to consciousness and affording to expression. So very simply we can say, through catharsis we are bringing out all the emotional problems which is hidden by the patient, and we are trying to purify that, and we are trying to make the mind pure and clear from all the worries which is disturbing the patient. Okay, therapist help the patient to see the root of the probable, and then by talking to some other means. So here the therapist will give instruction for the patient to ventilate all the repressed emotional feelings. Okay, So by doing that, the patient learns to evacuate the problems from the site. For example, in our room, when we have many dust, when many garbages, we cannot live very pleasantly and comfortably. Like that, in your mind, if you have more jealousy, when you have more kind of hacker feelings, when you have more kind of vengeance, so such things should be thrown out of your mind. So for that, the therapist asks you to express everything which is in your mind. So by doing this, the mind gets clear. So this is called catharsis, emotional ventilation of all the feelings. Okay. So when you have a pressure cooker, when the pressure is full, we cannot open the cooker, and you cannot. So what you want to do, so in that time you will ventilate all the pressure from the cooker, and you can able to eat the rice inside the cooker. So this is how the catharsis is acting in the human being. Now we are going to see abreaction therapy in the psychoanalytic therapy. Abreaction is a process by which repressed materials, particularly a painful experience or conflict, is brought back to the consciousness. Okay, those things which you buried in your unconscious mind, that we are going to bring it to the conscious level. Those repressed memories can be a painful, which you are experiencing in your day-to-day life. Okay, here, the patient is recalls the painful experience. We are going to recall all the memories which given trouble for us in the past, that we are going to recall it, and by doing that, our worries are relieved, and we are going to have disturbance free life. Okay, so mostly this abreaction therapy is done in neurotic conditions such as post-traumatic stress disorder and a patient who is having hysteria. So in this two condition, the response rate was very good and high. Okay. In abreaction therapy is different from catharsis. How? In abreaction therapy, the therapist is strongly encouraging the patient to relieve the stressful events. That is the first thing. Second thing, this procedure is done initially with the neutral topic, then we are moving to the general topics related to the patient life. For example, the patient having problem in the occupational life that is disturbing him very badly. First we focus on the friendship problem, then we focus on the love emotional life problem, then comes to the occupational problem. So like this we are doing. The next thing, abreaction therapy can be done with or without medication. So why medication is given? Medication is given to assist the patient to ventilate all the repressed memories. Some memories cannot come out of unconscious level. In that time, the medication is administered to assist in ventilation of feeling. Okay, the which medication commonly we are using is the IV. In the IV, we are giving thiopental sodium 500 milligram, which is dissolved in 10 cc of normal saline. That will be given slowly on a rate of 1 cc per minute. Why? When you give like that, the patient will not go for sleep, and respiratory depression will not occur in the patient. So by doing this, the abreaction therapy is done. So now we have completed all the techniques in the psychoanalytic therapy. In exam point of view, question may come a psychoanalytic therapy fully, or sometimes they ask specifically write short notes on catharsis, or write short notes on hypnosis or abreaction therapy. You must be able to give the answer very correctly. So this class gives you idea about the types of psychoanalytic therapy, and what are the methods of psychoanalytic therapy, what is the aim of psychoanalytic therapy, and how this therapy is done, what is the role of therapist, what is the role of patient. So everything we have seen in this video. So in another video, we will see about another therapy comes under psychotherapy. Okay, maybe we will discuss about individual psychotherapy and group psychotherapy together. So thanks for watching this video. Hope you enjoyed this lecture. If you have any doubt, don't hesitate to contact me to clarify your doubts. See you again. Take care. Bye bye.